Here we are with another review of 2020 Democrat candidates. Obviously, we just had the first round of the second set of debates last night, and we've definitely got some highlights coming up. Now, in the last few days, I reviewed Joe Biden, Elizabeth Warren, Kamala Harris, Bernie Sanders. Okay? Haven't gotten around to anybody like Beto or Marianne Williamson, Pete Buttigieg, for example. Haven't gotten around to any of those guys yet, or ladies. But there were actually a few other names I didn't really plan to go into too much. Never really cared for. One of them already dropped out, like Eric Swalwell. He was a real character. But then you've got people like John Hickenlooper, Delaney, all these other characters. Never wanted to dig too much into them just because they were already polling so low. Why bother? Why waste the time? I wanted to focus on people who actually had a little bit more momentum. Now, someone like Tulsi Gabbard, who we will get to eventually on this channel, I like a lot of things from Tulsi, so I'm going to cover her simply on the fact that I agree with some stuff she actually says. And so even though she may be polling low, I want to cover her because I want to spread that message out to the public. That way, if there is someone from this long 2020 field who gets nominated, I'm hoping it will be her. That way, if Trump does leave office, I'm more comfortable with who's going to be taking the office. And it's not going to be someone who either, is bought and corrupted, or I feel like their economic plan would just completely send us into the toilet. They don't have good foreign policy, or they may have a good talking point on foreign policy, but I'm not so sure how well they'd follow through on it. All right, so let's just jump right into it today. Let's go ahead and take a look at the first little clip we have here.
Tonight in America, as we speak, 87 million Americans are uninsured or underinsured. But the healthcare industry made $100 billion in profits last year. Tonight, as we speak, right now, 500,000 Americans are sleeping out on the street, and yet companies like Amazon that made billions in profits did not pay one nickel in federal income tax.
Congressman Delaney just referred to it as bad policy, and previously he has called the idea political suicide that will just get President Trump reelected. What do you say to Congressman Delaney?
You're wrong. 5 minutes away from here, John, is a country. It's called Canada. They guarantee health care to every man, woman, and child as a human right. They spend half of what we spend. And by the way, when you end up in a hospital in Canada, you come out with no bill at all. Health care is a human right, not a privilege. I believe that. I will fight for that.
So this is what I think we need to get done. We need the public option. That's what Barack Obama wanted, and it would bring health care costs down for everyone. And by the way, I just don't buy this. I've heard some of these candidates say that it's somehow not moral not moral to not have that public option. Well, Senator Sanders was actually on a public option bill last year, and that was Bernie, the Medicaid public option bill that Senator Schatz introduced. Clearly, this is the easiest way to move forward quickly, and I want to get things done.
What I am talking about, and others up here are talking about, is no deductibles and no co-payments. And Jake, your question is a Republican talking point. At the end of the day, and by the way, the healthcare industry will be advertising tonight on this program.
Thank you, Senator. Senator Warren, it's your turn.
Oh, can I complete that, please?
Your time is up, 30 seconds.
They will be advertising tonight with that talking point.
Congressman Delaney.
I'm the only one on the stage who actually has experience in the healthcare business, and with all due respect, I don't think my colleagues understand the business. We have the public option, which is great. The public option is great, but it doesn't go far enough.
The basic profit model of an insurance company is take in as much money as you can in premiums and pay out as little as possible in health care coverage. That is not working for Americans across this country.
Thank you, Senator.
Medicare for All will fix that, and that's why I'll fight for it.
Thank you, Senator. If Medicare for All is enacted, there are more than 600,000 union members here in Michigan who would be forced to give up their private health care plans. Now, I understand that it would provide universal coverage, but can you guarantee those union members that the benefits under Medicare for All will be as good as the benefits that their representatives, their union reps, fought hard to negotiate?
Well, two things. They will be better because Medicare for All is comprehensive. It covers all health care needs for senior citizens. It will finally include dental care, hearing aids, and eyeglasses.
But you don't know
Second of all,
you don't know that,
second
Bernie.
of all,
We'll come to you in a second,
I do know,
Congressman.
and I wrote the damn bill.
And the data is clear. Medicare does not cover the cost of health care. It covers 80% of the cost of health care in this country. And private insurance covers 120%. So if you start underpaying all the health care providers, you're going to create a two-tier market where wealthy people buy their health care with cash, and the people who are forced, like my dad, the union electrician,
Thank you,
will have that
Congressman.
health care plan taken away from him.
Thank you,
They
Congressman.
will be forced
I want to
into
give
an
Senator
underfunded
Sanders.
system.
I want to give Senator Sanders a chance to respond.
All right. Under Medicare for All, the hospitals will save substantial sums of money because they're not going to be spending a fortune doing billing and the other bureaucratic things that they have to do today.
I've done the
Second
math,
of
it
all,
doesn't add up.
maybe you did that and made money off of health care, but our job is to run a nonprofit health care system.
All right, so reviewing that footage, I want to make one thing clear here. The latest video I did was on Senator Bernie Sanders. And I basically said in that video, and I didn't get to really talk about Bernie as much as I would have liked to. Bernie is one I could go on for a long time about. I basically said within the course of that video that didn't support Bernie, wouldn't vote for Bernie. That is true, but I want to make one thing clear. It's not that I think Bernie is one of the worst options on the stage. There's a lot of things I disagree with Bernie on, but when he talks about the corruption, the healthcare companies making tons of profit, and that this system doesn't work for the Americans and that other countries are providing healthcare for their citizens, when he goes into topics like that, hey, he is right on the money. He is right on the money, okay? That being said, he took John Delaney to task. He just took him completely to task on that. So, you know, going into this a little more in depth, and I like one line. John didn't seem to give too much of a response to Bernie on it, but the one line where he said, "I don't think my colleagues understand the healthcare business," and Bernie shot back at him that it's not a business. Now, technically, Bernie, we both know it is a business. It's a very lucrative, very profitable business for those people. Okay? However, I admire your bigger point, and that is it shouldn't be a business. I have some serious issue with the fact that there is some Joe Blow out there sitting behind a nice little desk wearing a little three-piece suit who's raking in the dough over health care. And even though I certainly don't agree with Elizabeth Warren on a lot of stuff, I would vote for Bernie 10 times over before I would go for Elizabeth Warren. Even though she has a more progressive message, appeals a lot of, you know, populist talking points, and a lot of people support, I just don't trust that woman. And I have a serious issue with the fact that it took her how long to finally getting around to apologizing for putting that down that she was a Native American. Yet she stands on the talking points that a lot of the Democrat Party supports nowadays, and a lot of that is identity politics. You're going to shout racism, yet you're a blonde-haired, blue-eyed woman who claimed to be Native American to get into college. Okie dokie. So that right there, I feel like you're a phony. I don't care how good your message is, you're a phony. Can't trust you. Okay? That being said, back to Bernie, and then I'll cover Elizabeth Warren in just a minute. But Bernie makes the point, they're raking in profits off of this. They're making all this ton of profit, and and what kills me is while they're just tearing into John Delaney, he's just got this sneaky looking smirk across his face. It's one of those looks where they I don't even know that I have the words for that kind of look. It's just that you blue collar people out there may be able to relate to me. You ever see one of those over rich businessmen that just have that used car salesman look going on? That I'm such an honest guy kind of thing going on. Meanwhile, they're some of the biggest snakes in the grass known to mankind. That is just the impression that I got from just looking and listening to John Delaney. He just strikes me as a shyster. Plain and simple. I don't trust this guy as far as I could throw my house. Okay? So I'm glad that he's not polling any better. And for the record, I watched Mark Dice's video this morning. Apparently Mark Dice found people like Delaney and John Hickenlooper, or even what's this new guy they had on last night, Bullock, which I never heard much about. I think he got in the race here pretty recently. He found those guys to be the most reasonable. Now, there were some points that I heard them make that did seem to make some sense, okay, which we'll get to in a minute. Getting away from what Bernie and Warren were pointing out about how this healthcare system is so flawed, how people are not getting good coverage in a lot of cases. Now, some people are getting great coverage, which we're going to get to. Other people, like myself, who've been sitting without healthcare for 3 years and can't get a good plan, we're not getting anything here, okay? And meanwhile, you've got all these big corporate execs raking in lots and lots of money. And when Warren made this point, Warren was dead on the head here. Their whole business model, which is why I say Bernie, yes, it is a business, isn't a good one, but it is an actual business. Warren's point was that they have a business model of taking in as much money possible. Hint, hint, this is why their premiums are so high that people like me, who don't quite hit the $30,000 a year threshold on my own income, can't afford it. We can't pay for it. And unless you get a really good job that's going to offer you really good coverage, you're up the creek without a paddle, son. You're not getting coverage. You're not getting coverage. It'll bankrupt you. And even if you can get coverage, you're risking co-pays being so high you can never use it. So then that furthers Warren's point even more, that they have a business model, take in as much money as possible and pay out as much money as possible. And what does that sound like? Oh, gee, I don't know. Every business that has any sort of business acumen whatsoever, if you are a smart businessman, every businessman is going to run their business that way. You want to maximize profits. This is why free trade deals screw the American worker, because they can make more profit by screwing us out of our job to go make it for a fraction of the cost somewhere else and ship it back into the country and still sell it on our shelf cheaper than they could if they continued to make it here and provide decent living for American workers. Okay, that's why you have to have the government to protect the American worker, because the greedy corporate businessman is always going to do whatever he thinks he can to make more money. I don't care if we're making dustpans, shoes, tires, tables, chairs, or if we're talking about the healthcare business, or if it's just retail in general. Unfortunately, retail might be slightly different because you kind of have to have a store here. Of course, now you've got online sales hurting brick and mortar stores, another topic. But the healthcare business is the same thing. They want to make the most amount of money possible. And the reason why is because this is a private business. It's how all private businesses operate. It's all about the money. All about the money, that bottom dollar. How much profit can I make? That's what it comes down to. They have this issue dead on the head. So for the bashing that I've done on Bernie and Elizabeth Warren, I just want to make one thing perfectly clear. When it comes to this, hands down, you get no argument out of me. They're dead right on those talking points. Now, is Medicare for All the solution to it? I've heard convincing arguments on both sides, but let's play devil's advocate for a moment, because I do think that John Delaney made a good point here. So, there are certain union workers within the United States right now who actually have decent paying jobs that provide them good health care that they're satisfied with. They like it. They don't have massive waiting lines, which is, one of the points against Medicare for All. You'd have to go on a waiting list. Okay, so they don't have to deal with that. But at the same time, I feel like that's probably because there's a whole lot of people that can't get coverage, therefore they're not going to the doctor anyway, or getting these surgeries. If it was open to them, and it wouldn't bankrupt them to do it, I don't think you can avoid possibly that waiting list. But I don't think that's an argument why we shouldn't have it, because people have to go onto a waiting list, and so that the people who are rich can get their surgery without having to wait around. To me, I feel like, again, some people look at that different ways. Me personally, I feel like I don't think that if I need a surgery, someone that has a lot more money than me should just be allowed to jump to the top of the list because he makes $1 million a year and I'm an old blue-collar worker. Some people say, well, he's got the money, he can pay for it. It's not fair to him either if he has to wait on you, and yours going to have to be funded by taxpayer money. Okay, to each their own. To each their own. I see their point there. But at the same time, once again, I could see that being applied in other categories. I don't think healthcare is when it should be done. Okay? So the waiting list thing, I don't think you're going to be able to get around. But what John Delaney's point was, if you go to this Medicare for All system, it's going to strip the healthcare away from anybody that has it. Now, if you were someone who works for a company I'm working for, you don't have the best of healthcare coverage, and they offered you one that was more affordable, didn't have a huge copay to go along with it, and it provided you better coverage, if you wanted to strip that healthcare that I don't have because I can't afford away, provide me something better, or let's say I had it and couldn't use it, and you wanted to strip that away from me and give me something better, you're not going to hear one complaint out of me, son. Oh, no. I will happily agree to go along with your plan. However, if I were a worker that had a good union job, had good healthcare coverage, and some jobs do have good healthcare coverage, I'm not so sure I would want my options stripped away from me if I'm getting good coverage. Now, again, I'm no healthcare expert, so there are probably some other factors involved where, because what I'm going to say is that I think we should go to a system more or less similar kind of to what Buttigieg pitched, which was Medicare for all those who want it, except I've also heard counter arguments to that if you're having to buy into it, it'll be just like everything else, and you can't afford it. And if that's the case, well, piss on me because you didn't do me any favors with that either. Okay? So, with that being said, and once again, I don't want people to think I'm expecting a handout. I don't run to the doctor all the time and not pay a doctor bill. I've been avoiding the doctor for the last 3 years. If you've watched any of my other videos, I address this clearly, and co-workers can testify to this. When I stabbed myself in the hand earlier this year opening a box, my scissors jumped off and went into my hand. It looked like I had a golf ball inside my hand. It was swollen up so fat. Never saw a doctor, cleaned it at home, sealed it up with Loctite glue, put gauze wrap over it, and then Ace wrap to hold the gauze down. Continued to each day peel the Loctite off because it basically made like an artificial scab, clean it some more, put some Neosporin on it, Loctite it shut again, new gauze, new wrap, kept doing this every day on my own. Bloody mess, did it myself. There's a scar right there on my hand, and lasting damage from it. If I squeeze something too tight with this hand, sometimes I will feel like a pinch on the inside of my hand. I mean, there could be nerve damage from it, from all of it. But guys like me, hey, if there is nerve damage, guess what? I don't know. I don't know because I can't afford to go to the doctor to get it checked. So they're dead on the head. Now, he's got the point. A good union worker with that healthcare might not want their coverage yanked away from them. And so I like Buttigieg's idea, but if it's not going to help us afford it anymore, well, it's not helping us any here either. So there's definitely a debate that needs to be had. And I think that Bernie and Warren are definitely approaching that from a winning argument, from the people's perspective. Okay? John Delaney, on the other hand, even though he may have a point on that whole union issue, he sounds like the corporate elitist people who've been feeding us one line of bull after another, year after year after year after year after year. And him and Hickenlooper and Bullock are the guys like Mark Dice found to be the most sensible. And what did I hear their option was? Basically building upon Obamacare. Oh my God. Well, let me tell you something, guys. If you don't think Medicare for All is going to work, I got news flash for you. What you're pitching already failed. It was no good. It sucked. Guys like me couldn't afford that crap either because we made just enough money to not qualify for subsidies, but still too low that it didn't do us any good. And then if we didn't go to the doctor because we didn't have health insurance that we couldn't afford, we got fined every year. And just like I covered in one of my other videos, what really pissed me off is the fact that if you didn't have coverage for so long, because in 2016 I had coverage from January to August when I left the last job I had before this one. That's 8 months I was covered. I was told they would prorate that fine, which is basically for how many months you didn't have it. So there's 12 months in a year. I had coverage for 8 months. So divide 12 by 4, you'd come up with 3. Okay? So basically, 2/3 of the year I had health insurance. 1/3 of the year I didn't. So I'm expecting when I see that fine, which, if memory serves correct, was $695 for the full thing, for a full year, I'm only going to have 1/3 of that number. Income taxes came around, filed them in 2017, and they hit me for over $400. Now, the total was $695. I'm paying over $400. Somebody help me out here. Let's just do some math. What is 400 times 2? 800. 800. That's $105 higher than the total fine. That means instead of paying 1/3 of that fine, I'm paying over half the amount. How's that fair to a guy like me? It's not. It's not. So there's seriously a serious issue with the health care coverage in this country. And while I may not be fully behind people like Bernie and Warren, I got to give credit where credit is due. They hit this issue right on the head from a guy like my perspective, a guy like me. From our perspective, there's a serious issue, and there are way too many rich people in this country trying to make profits off our health because we can't afford to pay the high premiums to get the coverage to start with. They're playing games with our health. It has to stop. It has to stop. There's no other way around this. So for all my disagreements with them, for this talking point, Bernie and Warren, hey, you guys won this round without a doubt. You won this round. Thank you for tuning into this episode of the Independent Report. If you liked the video, please hit that like button and please subscribe to the channel. If you subscribe, ring that bell so you'll receive notifications when we drop new videos. Trying to grow this channel and inform more people of what's going on in the world around them. Thank you for your support, and we hope you tune in next time.